Hey guys, it's Dr. D'Anthony here, and I wanted to educate you a little bit on the importance of having your child checked by a chiropractor. Is it safe to have my kid checked by a chiropractor, or why is it beneficial for my child to be checked at an early age, even if they don't have pain? A lot of the problems that we have as adults, recent research shows that a lot of these problems start way back in early childhood. One of the earliest traumas is through the birth and the delivery itself. Then you factor in the slips and falls that you have from learning how to crawl, learning how to walk, jumping off of sofas, monkey bars, the early sports that we play. We always were taught as children, we just bounce off of everything, right? But over time, these small traumas as well as big traumas take a huge toll on the spine. A quick story for you guys. One of our parents that we take care of has a son that they wanted to start playing football here coming up this fall. And dad said, you know what? Why don't we get our son checked? Let's get his spine checked before he starts going into tackle football. And I said, that's a great idea. Let's get his spine checked. Child didn't have any pains, but they wanted to see, hey, is there anything that my child should be straying away from when it comes to the weight room, or is football ultimately safe given what you see in their spine? So we got them checked, and I just wanted to show you guys what we found. Take a look at this. One of the things that we look for in any new patient, whether it be a child or an adult, is degeneration of the spine. Also, you could say damage, which is synonymous with arthritis. To get your guys' bearings here, this is a picture of a child's spine. This child is 12 years old. The front of his stomach would be over here, and his backside would be over here. You're looking at the lower back from the side view. Each one of these white blocks, that's a vertebra in the spine. And then these black spaces in between the white blocks, that is where the disc is. We call those cushions, okay? We want to see those cushions nice and large. We took an x-ray of this child's lower back. What we found was this child has a severe amount of degeneration already developed in his lower back at 12 years old. And often the questions that we get asked from adults who finally come in, or their spouse finally dragged them in, the questions I often get asked are, how did this happen, or when did this start? And from my experience of treating thousands of patients over the years, is a lot of these problems start early in childhood. When we look at this child's spine, at L4, the disc space is about a little over 11 millimeters, and at L5, it's at almost 7 millimeters. This child has lost almost 50% of the disc height at this area. And why is that important? Well, at 12 years old, their body is still maturing. Their spine has active growth centers that are still trying to develop in the proper alignment. And if you were to start deadlifting, doing squats, maybe your child's in gymnastics and they're doing backflips, it's just more repetitive stress on their spine before they even hit their 20s, right? Then you factor in what they're going to be doing for the rest of their life. So important, if you haven't had your child's spine checked, whether that they're in pain or not, this is something that is typically shocking for most parents, finally seeing their child's spine, even if they're not in pain. Hope you guys found this beneficial. Get your kid checked. Have a great day.